This is a very important topic. It could be triggering for some of you, so just want to warn you. Domestic violence, it is not just a private matter. It's a real public health crisis affecting people across our community, and the numbers, they just keep rising. In Houston, just last year, 1 in 4 homicides were due to intimate partner violence. Even more disturbing, homicide is the #1 cause of death among pregnant women in the United States. It gives me shivers. Well, here to shed light on this crisis and what we can do is Deputy CEO of the Houston Area Women's Center, Sonia Corrales. Thank you so much for waking up with us and shedding light on this.
Thank you for having us.
When I read these statistics, it hits me really hard. And I know that a lot of women out there and men are watching and they're thinking, oh my goodness, I've been a victim of this. So tell us a little bit about what you've been seeing.
Yeah. So I will tell you, thank you for saying that. One of the things that people may believe is that it can't happen to me, or that somehow, you know, as you indicated, that it's a private matter. And it's so important to talk about the fact that this is a community problem and it impacts every single one of us. At the Houston Area Women's Center, we see survivors of domestic violence, also known as domestic abuse or intimate partner violence. And so we know that 1 out of every 3 women are impacted, and men are impacted as well. We know that women are impacted the most. And so we see thousands of people every single year at the Women's Center. There's about 50 to 60,000 calls on our hotline of people calling for information, for help. And it could be whether it's the survivor themselves, or it could be a friend or family calling and asking for information or help.
I really think that's important too, to advocate for somebody that you see signs that possibly they are being a victim of domestic violence or abuse. Now, a lot of people think that it's physical, but this also can be emotional and verbal too.
Absolutely. I think that's such an important conversation. You know, domestic violence, domestic abuse is a pattern of behaviors that are manipulative, coercive, where one person is trying to control the other. And so I think that that's important because it's a pattern of these behaviors, and it takes form in it's physical, it's emotional, which is very important to talk about. It is sexual assault. It is economic abuse. A lot of times people don't understand what economic abuse is, or don't understand it when they're experiencing it. It's spiritual abuse. And then from there, you know, there's abusers who use very specific tactics. So on the emotional abuse, which is also emotional violence, it could look like, you know, somebody belittling you, somebody putting you down, somebody telling you that you look ugly today, or somebody who makes you tell them where you're going, your whereabouts, somebody who does not allow you to make your own choices or decisions. All of those things are emotional abuse. Whenever you feel like you cannot do any of those things, you may be experiencing emotional abuse. And a lot of times, survivors experiencing that for a very, very long time and may not ever get physical. And so I think that that's an important conversation to have, because we refer to that as emotional violence. Somebody who does not allow you to go to work, or if you do go to work, then you have to turn over your paycheck, you know, to that person. If you're in a relationship and you're not allowed to go to school or make your decisions about going and furthering your education, that's also emotional abuse, because they're preventing you from moving forward in your life.
And I get kind of emotional talking about this because I've been a victim of that. And it's hard, and it happens dating, and then when you're younger too. And then I've been seeing, you know, friends and family members, they were teenagers and they were a victim of abuse. So what are some of the numbers? How young are we seeing this?
Oh, thank you very much for sharing that. I appreciate it.
Yes.
We are seeing this in high school. You know, we're seeing this also in middle school. I think the important thing to talk about when we're talking about this type of violence is what is a healthy relationship versus an unhealthy one. And I think that that's an important conversation to have with your children. We know that 1 out of every 10 high school students report that they were in some kind of dating situation. But we know that it's probably higher than that, because this type of crime is very, very underreported. So it's still very difficult for people to come forward, whether they're in middle school or high school. But a lot of times, because they don't understand that somebody may be disrespecting them
Right.
in ways that they don't necessarily understand, or they think it's funny, or, you know, oh, this person is jealous, so he must love me. And so that's one of the biggest things that we see with teens, is that, oh, well, he just loves me, and that's why he's so jealous. But jealousy is not love, and that's one of the things that we always talk about, because it is important to have these conversations with young people around boundaries, around what is healthy, what is respectful, and what needs to be in a relationship to be a healthy one.
And healthy relationships. And a lot of people, they think, oh, this can't happen to me. I know the signs.
right.
It's not. You would not believe who it's happening. I mean, it doesn't matter where you're coming from, your socioeconomic background. This could happen to any one of us, or women or men. I'm really upset about the pregnant women, and what can we do about that situation?
I think, you know, there's a lot of things that we can do, because when we started this conversation, we said, listen, it impacts everybody. This is no longer a private matter as people think, and that's an important conversation to have, is that domestic abuse, intimate partner violence, dating violence impacts every single one of us. So all of us have a role to play, and we can play that. Whether you're a friend, whether you're a family, whether you're a doctor, whether you're some other kind of professional, there's things that we can do. One of the things is learn about it. You know, what is domestic violence? What is dating violence? What are some of the elements there? What are the types of abuse, and how does it take form? Emotional abuse, what is that? And once you learn about it, if somebody tells you, or if you notice something, one of the first things that we can always do with survivors is believe them, because it is very difficult for somebody to come forward, because in a dynamic where there's violence, somebody's already making you feel like maybe this is not really happening. We refer to that as gaslighting.
Gaslighting, yeah.
Or somebody making you believe that somehow it's you are the one who's engaging in that kind of behavior, and so it's therefore your fault. So believing survivors is such an important thing. Saying to somebody, you know, you don't deserve to be in a situation like that, or you do not deserve that kind of abuse. So making sure that you're responding in a way that is going to be the most helpful, and then referring to organizations, you know, like ours. But in terms of like pregnant women specifically, when, you know, doctors, the medical professionals play such an important role in this, because we know that somebody who is pregnant is more likely to be assaulted, especially if they were assaulted before in a situation where there's already abuse. Somebody who is pregnant also is more likely to potentially die. And so those are important things to note. So if somebody goes to the doctor, it is important for doctors and the medical staff to have some kind of screening where they can screen for domestic abuse, so that we can ensure that that person gets the care, because the other thing is the impact on the baby eventually when the baby is born. And so we want to make sure that we stop, you know, all of those things.
I could continue talking to you. Unfortunately, we're low on time, but thank you so much, and for enlightening all of us about this. And somebody out there watching, maybe you know you're not alone. You know, it could happen to anyone, and there are resources. So I do want you to look at your screen right now, and we're going to have this posted over on our website, cw39.com. Click on the H-Town Live tab. Here are the numbers. There's a 24/7 hotline, you all. You can talk to someone in the live chat, and there's also a sexual assault hotline. All of those numbers are on your screen, and we're going to show them again later on in the show. But thank you for having this conversation with me, and it's not the end of this conversation, so I really would like to have you back on the show.
Thank you so much.
Thank you very much. And of course, I just want you all to know you're not alone. Stay tuned. We have more H-Town Live after the break.